this is Tessa. I just wanted to go over the 242 survival kit that's also posted on Canvas, just to kind of give you a better heads up. And we'll go over it little by little. Some of the chief concerns that I have is, or are rather, listed here on this first slide, because not all 241 instructors emphasize the same material or emphasize the same material for the same duration. So I find that students that take 241 with someone else and then take 242 with me, they tend to feel a little lost because they haven't necessarily mastered the same concepts that my 241 students are expected to have mastered. So let's talk about that list first, and then we'll dig in a little bit on the other stuff that's actually 242 relevant. From 241, you should know what a coelom is, but just in case, I'll cover that in just a hot second. And you should know what serosae versus mucosae are. You should know your tissues inside and out. Tissues should be the thread that's woven through all of anatomy and physiology. So hopefully they were very emphasized for you in 241, because they're just going to be very emphasized for you in 242. But I'll also talk to you briefly about which tissues seem to show up the most often in 242, and what particulars about them you need to know most, okay? And then I'll come back to this other stuff like the nervous system, etc., right? So I'm going to move for now to slide number 2, whose pointers are, at least some of them are a bit askew compared to the actual PowerPoint slide. I had to open this up in another app, and doing that sometimes makes the pointers a little funky. But the one that really looks a little off here is the mediastinum, which is not surprising at all, because the illustrator doesn't do a great job of showing where it is anyway. But all of these are coela. Coela is plural, coelom is singular. A coelom is an enclosed or internalized body cavity, okay? Whereas the oral cavity, the vaginal cavity, the anal cavity, the nasal cavity, those are all open body cavities or exposed body cavities, okay? And we'll come back to that distinction briefly, or soon, I should say, when we're reviewing mucosae versus serosae. Okay. Anywho, this slide 2, this image really shows us the chief coela in the human body, and the mediastinum is kind of poorly represented here, because in actuality, the mediastinum is sort of an hourglass or a figure 8 that sits between the lungs and therefore between the pleural cavities, okay? And therefore includes, or houses, I guess I should say, the esophagus, the thymus, the trachea, the very beginnings of the bronchi, and the pericardium, and therefore the heart, okay? So on the next slide, slide 3, which is blank, don't worry about that. It's just a blank sheet of paper for me to use. I want to emphasize, again, the difference between serosae and mucosae, which are plural terms. Singular for serosae would be serosa, and singular for mucosae would be mucosa. Insert Harry Potter joke. Serosae are the sheets that line. Actually, let me phrase that differently. I still don't want to phrase it that way. I'm not going to say line. They're the sheets that establish coela. Each coelom is kind of like a balloon, but the wall of the balloon is dual layered. So if this is a magnification of that wall, it's made out of 2 sheets, and each sheet is a serosa. This sheet is called the visceral serosa, and this sheet is called the parietal serosa. Serosae are only associated with internalized body cavities, in other words, coela, okay? And serosae are always, only, ever comprised of simple, squamous, or your 241 instructor may have said squamous. I don't care. That's fine, as long as you can spell it. Epithelium. Okay. Mucosae are the sheets that line open body cavities, like the oral cavity, the nasal cavity. Oh, the lady who can't spell cavity. The nice thing about that is that I can erase what I just did, so you'll never know. You'll never know exactly what it is that I spelled strangely. Excuse me. Well, mucosae are made out of different types of epithelia, depending on where they are and what we need them to do. So the most continuous, and therefore sort of the most area that's making up mucosae in our bodies will be made out of simple columnar epithelium, or non-keratinized squamous epithelium. Okay? However, we do also have more interrupted mucosa that's comprised of pseudostratified columnar epithelium, and this is all stuff that I lecture about in 241. We're just reviewing just in case, okay? Especially because serosae and mucosae are very relevant to viscera, and viscera are really the focus of 242, and viscera, hopefully you already know, means internal organs, okay? And you've already started picking up on the fact that, wow, we're going to need to really remember our tissues. So with that in mind, let's see if I can expand into a corner here and make some teeny tiny notes, because I'm running out of board here. Okay, so for the epithelia that we need to recall from 241, and ideally for the rest of our lives, oh, that's too fat. That's not going to work. So I can't sneak into the corner without losing some clarity. Here, I'll do this. I'll make a mess. That sounds good. We've got to know our simple squamous epithelium. And hopefully you already know that it's the thinnest stuff we've got. Okay? Certainly makes up serosae, but also is found elsewhere. So for instance, the alveoli of our lungs are comprised of simple squamous epithelium, at least primarily. And the capsule around our glomeruli, and glomeruli are networks of capillaries that look kind of like balls of yarn in the kidney. Okay, those glomeruli are encased in capsules that are comprised of simple squamous epithelium, and for that matter, the wall of a capillary, the lining of a larger vessel like an artery or a vein, would also be comprised of simple squamous epithelium. And that's what we want to emphasize most for 242, is where do we find these tissues? So locales are very important for 242. You need to know where each tissue is found, okay? Yes, we'll need to know simple cuboidal epithelium, and you probably already associate simple cuboidal epithelium with the kidney, which is great. And certainly that will be sort of our poster child for finding that tissue. It's also found in a lot of the ducts of glands, but probably the most relevant location for 242 at least will be kidneys, okay? We definitely need to know simple columnar epithelium, in part because it makes up mucosae of a lot, but not all, of the digestive system. So the mucosa of the stomach, the small intestine, and the large intestine is all really one continuous sheet of simple columnar epithelial tissue. Wow. Okay. And that's where we'll encounter that tissue most. Okay. We also need to recall pseudostratified columnar epithelium. That's going to line our nasal cavity. It's going to line part of our pharynx, but we'll get into that nitty-gritty when we get there. And then hopefully you're already associated with the lining of the trachea. Okay. All examples of mucosae. Let's see. For epithelia, we also need to know non-keratinized, stratified, squamous epithelium, and of course, contrast that with keratinized, stratified, squamous epithelium. The good news is that keratinized stratified squamous epithelium is only found in the skin, okay? Whereas non-keratinized stratified squamous epithelium, it lines our open body cavities that are especially exposed, those that are especially susceptible to abrasion. So the oral cavity is aligned with non-keratinized stratified squamous epithelium, and yes, I expect you to list all 4 words. The esophagus is lined with non-keratinized stratified squamous epithelium. The vagina is lined with non-keratinized stratified squamous epithelium. At least part of the anal cavity, at least we transition from non-keratinized to keratinized stratified squamous epithelium there. And part, but not all, of the pharynx is lined with non-keratinized stratified squamous epithelium. And again, we'll cover that when we get there, okay? For the epithelia, those are the chief heavy hitters. So, you should remember that the bladder is lined with transitional epithelium, but I'm not worried about you having to locate it or identify where it is, because we so already emphasize that it's urinary. For the connective tissues, I'm so running out of space, I'm sorry. Let's see. Dense, regular connective tissue, not so worried about it, because it's tendons and ligaments, which are associated much more so with skeletal muscle, and skeletal muscle is emphasized in 241. But, I lost my pencil. What happened? Did it die? No? I don't know. Here we go. Come on, buddy. Dense, irregular connective tissue. Yes, I expected to use all 4 words. we will see over and over and over and over again in 242, even though, it came up really often in 241. For instance, it comprises a lot of the dermis, because this is the chief tissue that comprises fibrous capsules, and so many of the viscera have their own private fibrous capsules. Okay, fibrous capsules is what you should think instantly when you think of dense, irregular connective tissue. Let's see, what else? Adipose, but that one's so easy, I don't expect it to be an issue. Loose areolar connective tissue, not worried about it. But loose reticular connective tissue will be relevant. That one, to me at least, looks like cherry blossoms, and at least my 241 students will recognize what I'm talking about. And we find that in the bone marrow, we find it in the spleen, and we find it in lymph nodes. And because spleen and lymph nodes will show up faux show in our lymphatic system chapter, which is coming soon, we definitely want to recall reticular tissue. Okay, let's see what other connective tissues are going to come back to haunt us. Hyaline cartilage. Definitely want to remember really what that looks like, and my 241 students will probably recognize the phrase nerds in jello, because personally I think hyaline cartilage looks like somebody brought an entry to the weirdest dessert contest, and their entry was to simply dump the candy nerds into a batch of setting jello. So hyaline cartilage, really so many locations, but will be particularly relevant in the larynx and the trachea. And then for a hot second, we'll also need to come back to elastic cartilage, because it's what comprises, or reinforces, I should say, the epiglottis, which will be relevant this quarter. But we don't need to worry about ear or nose. Those are 241 things. That's all the connective tissue that I can think of that's really going to come back to haunt us. And even though that list of tissues is fairly small, or at least this list thus far is fairly small, boy, do I find students struggling with it. So really, really make sure that you have mastery and that you practice. And on our Canvas site, you'll be able to find a really big file that's called Practice Your Tissues. I don't know that you actually need to practice your tissues. You might feel like you're not all that rusty, but for those of you that are, it's not a bad idea to go through and just make sure that you can identify which tissue is which. But again, more important, at least in 242, is to be able to identify locales. Where is it found? Where is it located? Okay? And then other tissues that will be relevant in 242, we will run into nervous tissue a little bit. However, we're not really going to zoom in on it enough for it to look like telltale nervous tissue. So I'm not going to put it on this list. I am, however, going to put cardiac muscle on this list, because in 242, the heart is kind of like the new skull. It's not the new brain. It's not that evil, but it's kind of like it's just got so many different features. It's kind of like learning the skull all over again. And so, for instance, in 241, maybe your instructor hosted a practicum in addition to traditional exams, and chances are that practicum had oodles and oodles and oodles of skulls on it, asking, well, for this hole and that slit and this dip and that line, and oh my God, name this bone, right? Well, the heart is now that beast. So when we do take our practicum, and in 242, that's at the end of the quarter, the heart will show up many, many times, because there's just so many features to point out. And then for this first exam 1 in 242, we're also going to really be exploring the nitty-gritty of heart anatomy, so even microscopic anatomy, as well as the physiology. And so for that, we're going to need to compare cardiac muscle with the other types of muscle tissue. And so that's going to come back to haunt us, okay? Anywho, now that I made a total mess out of this slide, which is the third slide here, I'm going to actually go back to the first slide and address that set that I circled originally. So we need to know what a coelom is versus an open body cavity. We need to know what serosae and mucosae are and who makes them up. We need to know our tissues, especially those that I've emphasized already. And then we also need to know our nervous system hierarchy. And that, I don't think I put a copy of that here, but I'll see if I can squeeze it in somewhere. I think there might be some space for us to make a mess next to the skulls. Okay, but that hierarchy is very important for you to have mastered, because sympathetic and parasympathetic will come up in every single chapter in 242. And if you don't know that those are autonomic, if you don't know that those are motor, if you don't know that those are peripheral, then man, this class is just going to be even tougher for you. Cranial bone markings usually scares students when they hear that, but if you really thoroughly learned your cranial bone markings in 241, you'll be shocked by how little you need to be able to recall in 242. If, however, you didn't master those cranial bone markings, or your instructor just didn't emphasize maybe as many as I do, then this is going to hurt. Okay, so let's move on to cranial bone markings. And I've included on slides 4, 5, 6, and 7 some images from 241 that are especially relevant in 242. So you still need to know your sphenoid bone, you still need to know your ethmoid bone, and you still need to know especially the bone markings of the ethmoid, okay, or at least some are especially relevant. The middle nasal conchae, which is plural, concha is singular. The superior nasal concha would be singular. The perpendicular plate will all be relevant in 242. And I find that students who had a different instructor for 241 sometimes have not mastered the conchae, or they just don't understand the conchae, because they're confusing as all get out. So I understand. So I'm going to make a really crude doodle here of the ethmoid. So if this is like the bulk of the ethmoid, the body of the ethmoid, then it's got lots of projections. Here's a projection to represent the perpendicular plate. Here's a projection. Boy, this thing's starting to look sillier and sillier. To represent the superior nasal conchae. And here are some projections to represent the middle nasal conchae. Okay? Whereas the inferior nasal conchae, which is plural, inferior nasal concha is singular, they are separate bones. They are not bone markings. They are separate bones. So they would be roughly here, but separate bones. Okay, be careful about that. And then the vomer is another bone that will be relevant and unfortunately confusing. So let's turn this skull so that instead of the face looking at us, we'll have the face looking that way, okay, to the right, okay? And we're going to use our x-ray vision, and we're going to look at that nasal septum. In other words, this wall here, this wall right here, okay? If we do that, then we'll better see, oh, that wall is actually comprised of 2 bricks. One of those bricks is the vomer, and one of those bricks is the perpendicular plate. Okay, so I actually find this particular image a little misleading because the illustrator shows the vomer, which really you can't see from this aspect. You'd have to be looking at the posterior of the nasal cavity to best see the vomer. Okay, but it's those two bones, ethmoid and vomer, that help to comprise the nasal septum. Okay, moving on, I'm on slide 4. Okay, the bone markings of the sphenoid that you need to be able to recall include the cribriform plate, the cribriform foramina, and hopefully you recall that the olfactory neurons, their axons, run through those foramina and synapse within the olfactory bulbs. And then you also need to remember the hypophyseal fossa, the depression, in the sella turcica. So if sella turcica is the whole chair, then let's see if I can change colors. I know I can, I just don't remember how. That's not working. Oh, how fun. Okay. Then just here is the hypophyseal fossa. Just the depression. Okay? And the reason why those are going to be relevant in, I can make my pencil finer. I did not know that this whole time. Oh my God. Anyway. Distracted by computer. The reason why that sella turcica will be relevant, and by the way, I've turned it like crazy. So this would be that part, and this would be that part. I've turned it like crazy. Anyway, the reason why it's going to be relevant is because the pituitary gland sits in there. And the pituitary gland has another name. It's also known as the hypophysis. So that's actually where that root comes from, hypophysis, hypophyseal. Let's go to slide number 6. You'll need to, there's that vomer that you can better see now. You'll need to recall the palatine bone and the maxillae, and that they together reinforce the hard palate or comprise the hard palate. That will be relevant. And then let's go to slide 6. Slide 6 better shows us, oh yeah, there's a shelf. There's a shelf. Oh yeah, there's a shelf. Oh yeah, there's a shelf. And these shelves are the nasal conchae. Superior nasal concha, middle nasal concha, inferior nasal concha, because we're only looking at the left side here. We're not seeing the right side. And then we can also better see that the hard palate is comprised of maxilla and palatine bones. Okay? Anywho, let's see if I can squeeze in, the nervous system hierarchy. I'm going to straddle slides 4 and 5 because there's a little space in there. And see if I can squeeze that in. And I'll make the pencil even finer. Okay. Oh, that's so nice. Okay, central nervous system, peripheral nervous system, they have to be able to communicate because the central nervous system interprets and plans, but it can't actually detect stimuli, nor can it command effectors directly. It needs the bridge of the peripheral nervous system in order to do that. Okay? The peripheral nervous system is further branched into sensory and motor. Okay? Sensory input, therefore this pathway is afferent. Okay, and then the central nervous system again is going to interpret that sensory input and come up with a plan. That plan is relayed along the motor pathway, motor output, okay, which is headed to effectors, and therefore this pathway that I just reinforced is the efferent pathway. our motor nervous system is further divided into somatic, which is the pathway that innervates our skeletal muscles, and autonomic, which is the pathway that innervates our glands, our smooth muscle, and our cardiac muscle. Well, if we are going to be emphasizing viscera this quarter, glands, smooth muscle, cardiac muscle, that pretty much describes all of your viscera. So autonomic nervous system is going to be a big deal. And the autonomic nervous system further is divided into, oops, that is not the shape I wanted to make. There we go. Sympathetic, and I never make this short enough. Good grief. Parasympathetic. Okay, I'm making a sloppy mess, but hopefully these things ring a bell at least. And my 241 students typically associate sympathetic with like strong emotion, like sympathy. Okay, and their mnemonic for parasympathetic was paraslippers. When you're ready to relax, you put on your paraslippers. And hopefully you recall that many of the effectors that are innervated by sympathetic pathways are also innervated by parasympathetic pathways, and that's called dual innervation. Okay, we'll come back to sympathetic and parasympathetic so often this quarter, so you really have to know that hierarchy. Okay, I'm going to go back up to our very first slide again. Okay, so we've touched on all of the review that's especially important, and now I just want to highlight what's coming our way. So, depending on the instructor, you may learn the different chapters in a different order than what I teach. So, what I teach is endocrine, heart, and blood vessels for exam 1. Because the endocrine system is a beast. But there's a lot of information in the blood chapter and a lot of information in the immune chapter. So I don't want to put heavy chapters together more than I absolutely have to. Therefore, blood, lymphatic, and immune, I teach those for exam 2. Respiratory and digestive, both fairly bulky. Exam 3, urinary and reproductive, show up on the final alongside cumulative questions. Okay? And if you're previewing or if you want to know what's especially tough from these different chapters, then that's what the rest of this slide is for. So personally, I don't learn well, or at least I don't learn everything well by reading, but I would recommend that you read or at least browse, at least skim chapter 16 sooner than later, chapter 17 soon, chapter 21 soon, as soon as you can. I mean, you've had A&P before. You know that it gets out of control really, really quickly. So if you can read sooner, then that's better. Aldosterone regulation mechanisms will show up over and over and over again this quarter. such that if you don't master them the first time, you're just going to get hurt over and over and over again. So I've included that in the subsequent slides, and I'll talk to you really briefly about that shortly. Aldosterone regulation shows up in 3 different chapters. It shows up on at least 2 exams, so you just have to master it. There is so much heart anatomy that it's smart to start rehearsing just the basics even now, okay? Blood clotting is a beast, so it wouldn't hurt to start looking at that now. CO2 release and pickup, or CO2 transport, it's sometimes called, that's a beast, so it wouldn't hurt to start looking at that now, okay? Some really horrible vocabulary terms that are gonna come up: glycolysis, glycogenesis, glycogenolysis, and gluconeogenesis. I know it sounds like I'm kidding, right? So start practicing those now, just because they're so easily confused. And then really is an argument to help keep sympathetic and parasympathetic straight, clear in your minds. Keep the figure 14.2 handy. So let's move on to the slides and see what's coming our way. If you go to slide number 8, this is the layout for the 4 aldosterone regulation mechanisms. And we'll actually put even more information on here via lecture. But there are 4 different mechanisms, and the one that's going to come back to haunt us the most is, of course, the most crazy, the most complex, and that's the renin-angiotensin-aldosterone mechanism. Okay, doesn't make a lot of sense right now, but it really would not hurt to look at it now. The next slide, slide 9, there's the heart, and I've given you a list of really just the basics. There are more details that we need to know, but here's the bare minimum. Okay, so start looking at that. If you go to slide 10 is one way to lay out the pathway of blood clotting. And yes, we have to know all those Roman numerals. So much fun. Pathways, and that's really the theme for 242 is pathways. So much physiology, so many pathways. I personally find the trick to studying pathways to be making a puzzle, and I'll help you do that often. Let's go to slide 10. Slide 10 is depicting CO2 transport. So here, the blood is picking CO2 up from tissues. Here, the blood is surrendering CO2 to the lungs. Okay, and you can see that that's just so detailed, and therefore it's probably going to hurt. And then, also, there was something else I wanted to show you. Now I can't remember. Oh well. Anyway, if we go to slide 12. Nope, I'm sorry, 11. This is, it's askew here, but when you look at it through PowerPoint, it'll all line up just fine. This is a tesserized figure. And whenever I say that a figure is tesserized, it means that I've altered the original figure to make it even more informative, aka even more of a nightmare. Okay. And this really highlights for us some of the chief differences between sympathetic and parasympathetic innervation. Okay, it's a good idea to keep that handy. And then the very last slide, slide 13, is another tesserized figure where we're going to need to trace the sensory and then the motor pathways that will be featuring the most frequent act potentials in the face of different stimuli. Okay, so that'll come up relatively soon as well. So I would look at that sooner than later if I were you. Anywho, that's just to kind of warm us up and let us know what beastliness is coming our way. Let us know what we need to have mastered from 241. Thanks.